Robert F. Kennedy Jr., President Donald Trump's choice to lead the U.S. Department of Health and Human Services, told senators Wednesday the United States faces significant health challenges that require fresh thinking.
I've often disturbed the status quo by asking uncomfortable questions. Well, I'm not going to apologize for that. We have massive health problems in this country that we must face honestly.
A former environmental attorney turned healthcare activist and author, Kennedy receives strong support from Senate Republicans considering his nomination to lead the $1.7 trillion government agency that controls healthcare that covers half the nation.
You represent a voice for an inspiring coalition of Americans who are deeply committed to improving the health and well-being of our nation.
But Kennedy faces significant concerns about his past statements about vaccines, reproductive rights, and AIDS.
Mr. Kennedy has embraced conspiracy theories, quacks, charlatans, especially when it comes to the safety and efficacy of vaccines. He has made it his life's work to sow doubt and discourage parents from getting their kids life-saving vaccines.
Kennedy said some of his most controversial remarks during a podcast interview had been taken out of context.
I said there are no vaccines that are safe and effective, and I was going to continue for every person. Every medicine has people who are sensitive to them, including vaccines.
Right. So
he interrupted me at that point. I've corrected it many times, including on national TV.
Kennedy pledged to support childhood vaccines if confirmed. But senators are concerned about his statements about a range of health issues, including his statements about COVID-19.
Did you say that COVID-19 was a genetically engineered bioweapon that targets black and white people, but spared Ashkenazi Jews and Chinese people?
I didn't say it was deliberately targeted. I just quoted an NIH-funded and NIH-published study.
His conclusions from a 2020 report have been dismissed by scientists. Kennedy was also asked about his views on key programs impacted by President Trump's foreign aid funding freeze, including PEPFAR, a successful AIDS prevention program.
I'd like to know whether you support the objectives and goals of PEPFAR, and would you work with me and my colleagues to make sure that this program continues to provide life-saving antiviral drugs to people who are most in need?
I absolutely support PEPFAR, and I will happily work with you to strengthen the program.
The Senate Finance Committee will vote on Kennedy's nomination in the near future. Catherine Gibson, VOA News, Washington.